All right, everybody settled? All right, so our next presenter is Anna Keller. She is a senior health sciences major. And in 2018, she interned at the Cardinal Hill Rehabilitation Hospital in Lexington, Kentucky. There, she performed extensive nursing care for patients with both brain and spinal cord injuries. And in December 2018, she was dismissed from the Berea College nursing program, but was hired by the Ridge Behavioral Health System, also in Lexington, Kentucky, where she administered psychiatric and addictions treatment. These two experiences have had a transformative effect on Anna's clinical studies. Let's hear about it. Anna?
I want to start by saying another title that I could have for this presentation is Demobilizing is Hard. When I sent my draft to Dr. Hackberg, he said, "What's demobilizing?" I'm going to talk about what I used to do before. Demobilizing means not doing that anymore. So people who come from military and working in conflict situations in private sector, lots of times when they try to get into civilian life, it sucks. It's hard. It takes years. So that's a lot of what my story's about. I'm going to tell you a story about overcoming here at Berea. In the last year, I overcame a lot. I'm proud of myself. I'm grateful to the people who helped me, and I'm going to tell you about it. First, my name's Anna Keller. I ride a motorcycle around town in a dress. Yeah, you see me. I teach CPR. I audit workplace safety. I write procedures to bring workplaces into regulatory compliance. And on the weekends, I provide care and lead groups in an inpatient psych hospital. I'm a member of EPG Cohort 14. Before coming to Berea, I worked in dangerous conflict and disaster zones. I provided healthcare and launched social healthcare startups. 15 years ago, I co-founded a federally qualified health center that started out looking, well, like that. In New Orleans and a peer mental health support network in Pittsburgh. They're still serving low-income communities of color today. And the work was stressful, but I was good at it, till I wasn't. To demobilize and keep doing the work that I loved, I needed a nursing license, and I didn't have one. What I did have was a heavy burden of battle trauma. I couldn't do the work I loved, and I became a homeless drug addict. Seriously. 10 years sober, at the end of the 2017 EPG Summer Institute, I wrote this vision of my future accomplishments in 2017. I'm a writer. I'm going to read what I wrote. Our rural health program was the first of its kind in this country. We do proactive health planning, education, prevention work, and basic direct care. We aren't a clinic or a hospital, but we're as accessible as 911. When you call us, we come and begin problem solving at no cost to you. Rates of diabetes, opioid deaths, suicide, smoking, dental caries, and workplace injuries plummeted in our service area over the last 15 years. Our walking club successfully lobbied local government to make most of the county's built environment more walker and biker friendly. The closest psych hospital closed when our peer-based respite opened after 8 years of our on-call services led to a virtual disappearance of bipolar in our area and a drastic decrease of conversions of first-time psychosis to schizophrenia. Many of our workers started out as clients. They don't go into debt to get a job, so we can pay a living wage at a lower cost than places that hire workers who are heavily indebted to student loans. We provide more patient contact and create more jobs than highly professionalized segments of the healthcare sector. We retrain people who come to us through vocational rehab and people who've been out of the workforce, like ex-offenders. Training and service are at the heart of our program. Our community health workers are able to specialize, move into management, and get college credit through a partnership with the community college. From our beginning, relationships and partnerships have been central to our work. We employ no physicians, no dentists, no psychiatrists. We're most people's first point of contact with the healthcare system, but because we're community run, 35% of client health problems are beyond our direct care capabilities. So we frequently accompany clients to local clinics, hospitals, dentists, and drug treatment programs, where we advocate effectively for them. We partner with universities, health departments, and churches to provide high-quality, relevant health education and health planning. When problems are widespread among our clients, we have a reputation for being a force to be reckoned with. Because of our work, dentistry is much more accessible in our county than it once was. Senior citizens have a dependable network of care and remain active in community life. Unpaid caregivers have support and training and get breaks. The percentage of our population in prison has decreased dramatically, and hospital-acquired infections and bed sores are things of the past. Healthcare bankruptcies don't happen anymore. We know how things changed because assessment and evaluation are built into everything that we do. So that dream, nourished by Dr. Hackberg and the team that I spent so much time with in Bell County during the Summer Institute in the summer of 2017, continues to inspire me. The fall after Summer Institute, I was accepted into Berea's nursing program and started courting a woman also from EPG's cohort 14 who became my life partner. Sounds good? Well, it was, but this is supposed to be a story about overcoming. Here's where the story really starts. Get ready to hear about my internship, getting dismissed from nursing school, and why that's not a problem. Getting my internship wasn't that hard. The nursing department offers an internship with Cardinal Hill Rehabilitation Hospital in Lexington. I applied the week the application period opened. In my application, I wrote, I hope this experience will articulate with the rest of the education and clinical experience I get through Berea nursing to prepare me to bring the highest standard of care to people who may be accustomed to the lowest. I also wrote, I expect to learn the stamina, focus, professionalism, and self-discipline of a great nurse. By working consecutive 12-hour shifts at Cardinal Hill, my body will learn how to work a nurse's schedule, how to balance life and work, and how to do good clinical reasoning and emotion work, even at the end of a week of such a demanding schedule. Through the internship, I learned that I love 12-hour shifts. In most hospitals, nurses run the floor and physical therapists get very limited time with patients, but Cardinal Hill is run by the physical therapists, occupational therapists, speech and language therapists, rec therapists, and nurses just provide support for them. The hospital helps people recover from brain injuries, spinal injuries, strokes, and complicated wounds. It's a cool place to work. So I'm going to tell you about one of my patients. I'm going to call her Jenny. Jenny was transferred to Cardinal Hill with 31 large wounds, ranging from 6 to 30 centimeters in diameter. Much of the fat tissue in her buttocks, hips, and lower extremities had been destroyed. In a reflection, I wrote, the wound care nurse invited me down from brain injury to work with Jenny's amazing husband on her dressing change. Her husband and I used adhesive remover to quickly take the dozens of large foam dressings from his wife's buttocks, hips, thighs, and calves. I soaked the gauze in her wounds with diluted lidocaine for pain control. Then we gently and quickly unpacked the gauze, exposing large rotted areas of flesh that had begun to slough and granulate. Jenny looked into a wound larger than my hand on her thigh and began to cry. I placed a hand on her shoulder. It's so beautiful, Jenny said between sobs. I wished you could have seen how bad it was. I'm getting so much better. Her wounds resulted from a botched gastric bypass 14 years before by a surgeon who later lost his license for surgical malpractice. After years of being unable to absorb protein because of the bad bypass, Jenny's liver failed. It was unable to clear wastes from her blood, so ammonia built up and she went into a coma. During the coma, she wasn't moving and her veins weren't adequately draining her legs. The ammonia that didn't drain started to destroy tissue in her calves, primarily fat tissue because it has the least blood vessels in it. The tissue destruction made it up to her buttocks and hips, essentially rotting her from the inside out. Intensive care got her ammonia levels down enough that she came out of the coma. After she got off the ventilator, we got her in her 31 wounds. The first dressing change took 8 solid hours. Slowly, over more than a week of our aggressive nursing care, her wounds shed their eschar and began to heal the same way they formed, from the inside out. A week after I met Jenny, she was running a fever. I was pulled off stroke to help her with her dressing change and bath. Her husband helped, even though we were up to our wrists in slough, blood, serous discharge, diarrhea that smelled like Clostridium difficile but hadn't been cultured, and Jenny's tears. She was brave in a way that I can't imagine being. Her husband loves her in a way I've never seen a man love a woman. Over a couple hours, we got the dressings off. Due to the fever, it was impossible to control Jenny's pain. She begged Jesus to take her. In the shower, she lay on the shower stretcher and washed her own face and torso. The physical therapist and the wound care nurse gently cleansed the small areas of skin that remained between the open wounds on her lower extremities. The diarrhea in her vagina and around her urinary catheter, her perianal area, and the wounds. housemate and I held the shower head and handed them towels and washcloths. Once she was dry, we redressed her wounds. Nonetheless, Jenny died. Her diarrhea was a common and antibiotic-resistant hospital-acquired infection. She couldn't be put on a bedpan because she had no buttock tissue left, so the unit doctor had written an order for her absorbent pads to be changed frequently. They weren't changed frequently enough. The bacteria clogged her urinary catheter, and she went septic. Now, if this story sounds awful to you, it is awful. But also, if it sounds awful to you, don't be a nurse. To me, being with people with this kind of story is exactly what I love to do. I told a nurse friend the basics of this story. She said, remember that when you work nights for the rest of your life. What she meant was, don't get lazy. Don't say, we don't do that at night. Recognize that every intervention matters, every shift. While I was reaffirming exactly how much I love nursing, I was also learning exactly how much I needed to shut my mouth, cover my hind end, and ask for help when I needed work from my supervisors and play politics a little. In spring of 2018, my smart mouth was not appreciated by one of my nursing professors. I tried to make good with her, but she nursed a grudge. In the summer of 2018, I got the goat of one of my preceptors at Cardinal Hill for making a bad call about a patient with a brain injury who wanted out of her restraint vest. My decision made extra work for that nurse. In fall of 2018, it started with hostility from the professor who held a grudge against me in the spring. I built a network that included the campus chaplain to help me figure out how to fix the situation, but I couldn't fix it. I was part of the problem, and it had been going on for too long. A week before I expected to take my final exams and see a bunch of B's on my transcript, I was dismissed from nursing school. I was shocked and heartbroken. I wondered if maybe I wasn't cut out to be a nurse. I took a leave of absence to work, appeal the decision, and figure out what I was going to do. During my leave, I applied to the Ridge Behavioral Health System, a mental health and substance abuse hospital in Lexington, where I've done clinicals. My clinical instructor gave me a glowing reference. So did my labor supervisor and a nurse that I'd worked with a lot before I came to Berea. They hired me, and I love it. Been working there for 9 months now. I lost my appeal of the dismissal decision, but I decided to come back to Berea anyway with a different major. I graduate probably this December, a semester early. After I graduate, the Ridge agreed to pay 100% of my accelerated nursing degree program in the Dr. Hackford told me that my story is about strength, resilience, and willingness to learn from setbacks. Some setbacks I brought on myself, others were outside my control, most were both. Regardless of why I got knocked down, I got up. Let me connect my story to abilities everybody in EPG's had the opportunity to explore. Recognizing opportunity. When I saw the Cardinal Hill internship, I looked at the website and I talked to some students who'd already taken it. I didn't really understand what I was getting into, but I knew that it was going to be an opportunity for me to grow, so I went for it. When I did clinicals in nursing school, I got the phone numbers of my clinical instructors and my preceptors, and I stayed in contact with them. They were mostly willing to be, they were all the ones I contacted were willing to be references, and one of them, Cherry at the Ridge, hired me. I was hired by my favorite clinical site. Rather than get stuck there with limited chances for advancement, I recognized and mobilized the opportunity that Berea College is, and opportunities to complete my nursing education debt-free at UK. Exploring values and ethical structure. So there's a lot that's morally wrong in Jenny's story, and the stories of other people I've nursed. There's plenty of room to advocate change. What was right was that her husband stuck by her and loved her, that she got excellent nursing care from the wound care nurse and the interns that worked with her, and she had deep and unshakable faith in God. There's a lot that was morally wrong about what happened in the nursing program here, but what was right was how the chaplain and the director of the Appalachian Center stood by me, how I documented what happened and pursued my claims to the appropriate authorities, and how I refused to talk trash or tell tales during this presentation. It's right that my nursing classmates unwaveringly stood by me and that I'm learning to let the hurt go. Engaging complexity and uncertainty. Heartbreaking problems in healthcare, and health worker education have no straightforward solutions. The path from the current reality to a better future has to negotiate people, long-standing bad habits, confusing bureaucracy, entrenched financial interests, and plenty of self-doubt. I've learned to document bad behavior by coworkers and supervisors and pass it up the command chain, to build and maintain great relationships with management, to watch my own behavior, and to be more patient and self-assured in team efforts than I used to be. I reckon that's a start. So I have some advice for students with a few years left here at Berea, especially those who've overcome huge challenges and obstacles. Do good work. Know why you're doing it. Learn from absolutely everything that comes your way. Get contacts of people who've seen you work and use those contacts. Be honest and pray when you're scared. Change direction when you have to. If you follow your heart and do what you say you're going to do, you might find a future you look forward to, work you love, and someone who loves you completely. Thanks. I went a little over, so probably only a couple questions.
I felt like when you were talking about Jenny, it was like a story that I see as well when I go to the clinicals. And as nurses, we are taught to be advocates for patients. We're taught to be self-determined towards things and not listen to whatever the higher authorities like doctors are maybe saying or people with authorities. It seems like you upheld that role of the nurse, and I'm really proud that you're still maintaining that stance.
Thank you. I wanted to say that I told that story with a lot of detail. And part of the reason that I told that story with a lot of detail is because there are a lot of injustices that people study in college. And a lot of the things that nurses see in hospitals, we don't talk about in detail. And a lot of the details of those injustices, if they were more known, then people who work on remedying injustices would be able to work on them more. 17,000 people die every year in the United States, like Jenny does, from catheter-acquired urinary tract infections. And every single one of those is due to neglect. The Joint Commission says they should never happen. Any more questions?
So, Anna, I know you are a very determined person, and it's, I must congratulate for that. But those stories and personal experiences, how they are going to contribute in your, in your healthcare service, your service in healthcare.
I think I learned from working in conflict zones. The way that I saw the work that I did there was that I came as a medic for communities who were trying to survive, right? So kind of like a military medic. The goal is not this individual patient's health. The goal is the success of the mission. The mission might be that these people get to stay in their houses. The mission might be that this neighborhood gets to be rebuilt by the people who lived there before the thing happened, whatever, right? So seeing people's individual and collective goals as being what I'm working towards supporting in healthcare is different than just restoring this person to be able to do most of their activities of daily living. I think there's a lot of dignity that comes in through that. At Berea, I think I'm in the process of learning a lot more professionalism, because when we worked out in those kinds of scenes, I mean, it was cowboy all day. And learning how to work in much more bureaucratic environments, learning how to work in much more liability-averse environments, learning how to work in environments with really entrenched coworkers who are not great, and learning how to keep your cool when you're used to turning up whenever something's wrong. That's hard for me, So that's a big part of what I'm learning at Berea. I think if I put those two things together, I'm going to be a killer nurse.
Thank you.